Well, taking your child out of school and to the doctor's office can be a little bit of a hassle, but necessary, right? Well, in Deer River, they have started the region's first telehealth service right in the school. And on National Rural Health Day, it's the perfect time to highlight that. Deer River is pretty rural. Although they have a clinic and hospital in town, some people need specialists, like Sadie, a speech therapist.
What were we focusing on today? What kind of questions was I asking?
She and Paisley meet right inside the Deer River High School.
Set a timer, and you were going to write it in your what?
Binder.
It's part of the newly launched virtual healthcare system, done in partnership with Essentia Health.
Our tech team had been working with some other schools and had placed two other virtual access points within our system. And so we had brought that idea to the school and they got on board with that. They thought that'd be a great place to start.
They've been running now for 1 month.
Getting used to it, and I think I'm starting to love it.
Paisley is in 9th grade and said the adults in her life help her manage the appointments.
First, my mom told me, and then my teacher told me, and then I will do it.
The space is right next to the nurse's office, so very convenient. Another layer to Deer River being a full-service community school. That means they work on addressing barriers their students have, like transportation.
To be able to offer stuff to our kids in the building, and some of our families just don't have transportation or the ability to take their child to the clinic.
Even with medical providers right in town, it still means time out of school. And if you head to Grand Rapids or Duluth, it could be a lot of missed class.
Because we have kids who take medication that monthly they have to check in with a physician to make sure it's going okay, and before they were going to an appointment that they'd miss like 2 hours of school. And this way it's like a 15-minute chat to be like, how's the medication going?
This has been in the works for years as part of an effort to create a school-based health center. Susan Johnson is the project manager who came on board about a year and a half ago.
Telehealth was the first step, and now we want to take it to another step, and that is to make some in-person visits.
They are scoping out a bigger space in the building for more services and potentially more providers.
Our students are 46% Indigenous, and that is a very, very high number compared to most areas. So it's essential that we work with Indian Health Services and get them in here so we are taking care of all the students as a whole.
It's a big opportunity in the small town on the edge of Itasca County.
Other schools have started talking to us, which has been really exciting too. Duluth, we've been talking with the community schools in Duluth too.
And benefit even more students, just like Paisley.
So we'll get there. We'll get there.
We want to thrive, not just survive.